Hello everyone and welcome to Vet Candy Pop, your go-to source for all things trending in the world of veterinary medicine.
We're your hosts, Dr. Elan Armstrong
and Dr. Shannon Gregoire.
And we'll be diving into the hot topics, breakthrough treatments, and cutting-edge research that's shaping the future of veterinary care.
We'll break it all down for you in quick, bite-sized episodes, whether it's new trends in pet health, industry insights, or even the latest challenges we're all facing as veterinarians. We've got you covered.
Get ready for an exciting ride as we tackle the tough questions and keep you up to date with everything you need to know, all in 15 minutes or less.
So grab your coffee, sit back, and let's dive into today's episode of Vet Candy Pop.
This program is brought to you by PRN Pharmacal, makers of Reconcile, fluoxetine hydrochloride. Learn more at reconcile.com.
So let's talk about work-life balance and burnout prevention. So did you know that according to a 2023 survey by the AVMA, they said that about 52% of vets experience burnout? Yeah. What are your thoughts on that? Like, how do you tackle it?
Yeah, it's pretty crazy. I mean, it doesn't surprise me after going through COVID and all the crazy stuff we've had to deal with and how fast our industry has changed in the last couple of years.
Yeah.
For me, I think burnout is almost like another emotion that I kind of feel sometimes and then it goes away. It's usually when I'm not respecting my own boundaries or if I'm trying to get a lot of stuff done and, you know, I work a little bit too hard sometimes, but I then try to take some time and relax and kind of reset.
Yeah.
But what about you?
Well, I'm part of that 52%. It's kind of hard. I mean, so working in the ER, for instance, I don't really have a lot of designated time to eat and just take a break. You know, I know a lot of times in other sectors, you know, you have your designated like lunch period. So maybe you can take a break from the hospital and just like do some woosah. So it gets a little tough when you're on the floor. So what I do when I'm actually working is I'll run off to the bathroom and just spend 5 or 10 minutes and just stare at myself in the mirror, just like, what am I doing here? But I just need that time away from everyone, so that helps. And then, of course, like when I'm not working, I just try not to think about work at all. That's like the only way I can combat it at this time.
Yeah. Almost like treat you like Dr. Elan as like a persona, and she only exists at work, because that's what I say. Dr. Shannon only exists at work in the clinic.
I like that.
And then Shannon in the wild is not a veterinarian.
I don't even want people to call me doctor outside of the hospital.
No.
Yeah, not at all.
No, we're good. We're only in those four walls, and I like take on that role, and then when I'm done, I'm done. And I feel like that helps. Yeah.
So what do you do whenever you feel like you're going through burnout?
I try to message one of my friends and like, I need a spa day, or like, let's go get a massage somewhere, or like something where this whole environment of where we're going is meant for relaxation. Yeah. Like the whole environment, the music, the smell, just the whole interior design is just like very relaxing to me. And I have to force myself like off my phone for a couple hours and just like sit and breathe and talk about like silly things or whatever else is going on in our lives, like blow off steam with conversation. So just something very out of the ordinary to kind of switch your mind out of that daily grind.
Absolutely.
Yeah. What about you?
Tell my husband we're having another baby and go on maternity leave.
Just kidding. 3-month vacation.
Yeah, but truthfully, whenever I get back from maternity leave, I feel so refreshed. And yes, it is 3 months. And that makes me wonder, do we need that time off from work? Like, imagine just having like 12 weeks.
Sabbatical.
Yes. And then you come back and you know, everything, again, just feels so refreshed. You have like this zest now, the spark, you know, the spark's been reignited. Taking off a day here and there, for me personally, it doesn't do anything.
Yeah.
It really doesn't do anything. I just need to literally not hear a dog bark, a cat meow. I need Serenia. I need to not hear that for a long time, and then I'll be okay.
Yeah. I do find like going to bigger conferences, like, and you get a lot of that social aspect with your colleagues, like outside of a clinical setting is super helpful for me. And you see all the new things, and like everyone's like super excited about what they're doing, and that a lot of times will be really invigorating.
Right.
And I have family down in Florida, so sometimes we'll try to take a long weekend, like 3 or 4 days.
I like that.
That seems to be enough
Right.
for me at this time to kind of go down there, but it's like a totally different environment.
Yeah.
What we do is totally different, and it just kind of breaks that
The
cycle.
Yeah,
Just
absolutely.
enough to break the cycle.
Yeah.
Yeah, but definitely some time away is really helpful.
I do like the conference idea. I've been to at least 1 or 2, and as you said, being able to interact with peers and learn new things and see faces and even vent, it's good. You know, knowing that like people are coming from different sectors of vet med, and pretty much we all have to vent about the same thing. We all have to laugh about the same thing, you know, and then you take a bit of what you've learned that's new back to where you're practicing, and it does feel fun and special.
And you bring something like, I just learned this, I'm so excited to use it.
Yeah.
It's like you got to give yourself something new to focus on.
Precisely, yeah. All right, Dr. Shannon, so just let us know, like, what do you do whenever you are experiencing burnout as a practice owner and whenever you were once employed? So you're coming from like 2 different perspectives. How does that work for you?
Yeah, I'm both in a really close time frame to each other. So when I was an associate, I think having long weekends back then was really helpful, because I felt like at one point that I was just living in the same 4 walls, and that was really troubling for me at that time. Then I switched to relief work, and I was traveling all the time, and there were some times where I worked every day for 2 weeks straight. And there was one month I can remember I had like 4 days off in the entire month, which, you know, trying to grind, pay some bills, save up for a practice purchase. But then the next month after that, I would schedule myself a lot lighter. So I think it's really a give and take, because it did really get exhausting. I think the part of relief that helped avoid burnout is that it's always different and new and exciting.
Yeah, absolutely.
So that I think really allowed me to overwork myself a little bit more. And I had a bigger goal in sight too, so I wasn't too worried about the day-to-day. It was just like another stepping stone to get where I wanted to go. But now that I'm a practice owner, I feel like I really, because I need to focus on the business too, I have to take a small step back clinically. I'm still working full-time. I'm not working 70 or 80-hour weeks anymore, because I do take 2 days off. And sometimes I'm like, should I really take that time off? Like, I don't have to pay someone, you know, relief to work, but I should have a day off. So I'm just going to take the day off.
Yeah, you need to recharge.
Yeah, and try to do some other things. And even recharging might be like me going through my emails, making sure everything's paid on time, making sure I don't have to talk to anyone on the business side or do any Zooms. But that's not as stressful for me, because it's
a different kind of stress.
Yeah, and it's something still more new too. So I feel like even unplugging just from the clinical side and being able to do something exciting with the business, like what are our goals for this day? I really like goal planning, kind of future planning, kind of going through where our team is. Are we adding more team members? Is there anything that we can purchase and maybe make a new purchase for the clinic, or doing social media strategy? So that stuff's kind of fun for me, and it's not the same kind of stress.
Correct. Yeah.
At least for me personally. So I feel like ownership has been really good for my burnout prevention, because I have a team around me, and I purchased somewhere where I really enjoyed the team, and I think that's super helpful. And I have a practice manager I can lean on. My fiance has been really great with helping with some of that stress as well. So really kind of creating that community around me, and I definitely couldn't do it all by myself, and I don't want to. Like, I have a great CPA financial team. I had a great attorney throughout the purchase process. And humor, I think, gets me through a lot of it.
Like, we know about the dark humor in vet.
Or even just like through the stress of the purchase, I was just like, thank God my attorney was like so great, and my CPA was too. Like, we just laughed about like just silly, stupid things that would come up, and just to get through the stress of the process. And so I wouldn't panic.
That's good. That's great.
Yeah. What about you, Dr. Elan? Like, being a mom, and especially a mom of, you know, multiple children, and still working like emergency and having a relationship, and how do you balance all that, or any tips for our moms? Because there's a lot of us that are either hopeful moms or current moms that are in our field.
It's definitely challenging. I will say that I do find relief whenever I leave the hospital to go home to my kids and my husband. They, make things so much better for me. Is there stress at home? Absolutely. I will not act like there isn't stress at home, but again, it's a different kind of stress, kind of like when you are breaking away from the clinical side of your business and then you're tapping into just business, right? So for me, again, just being able to wear different hats, it takes a lot out of me, but I truly appreciate it, and I'm grateful for the opportunity to be able to do so. So I can be Dr. Armstrong in the hospital, I can be mom at home or mommy.
Right.
And I meet everyone's needs. So I meet the needs of the animals, I meet the needs of my team, and I meet the needs of my family. Of course, I have to meet my own needs,
Right.
But that's like a different topic for a different day. So, we just do the best that we can as moms to be, and that's all. That's all we can do. Just the best we can.
Yep. Every day.
Every day.
Hello, I'm Dr. Wailani Sung, a veterinary behaviorist and owner of Bay Area Vet Behavior. And today, we're talking about separation anxiety. Management of separation anxiety typically necessitates a multifaceted approach encompassing behavior modification techniques and, in certain cases, pharmacological intervention. Medications such as FDA-approved Reconcile chewable tablets containing fluoxetine hydrochloride can be used adjunctively with behavior training to help with anxiety. Reconcile should be used in patients with separation anxiety that exhibit a high level of distress in the owner's absence. So, how does it work? Reconcile is a once-a-day flavored chewable tablet that contains fluoxetine hydrochloride, which is a selective serotonin reuptake inhibitor, an SSRI, and it is indicated for the treatment of canine separation anxiety in conjunction with a behavior modification plan. Serotonin reuptake inhibitors work by blocking the reabsorption of serotonin, a neurotransmitter responsible for mood regulation, into nerve cells in the brain. By preventing serotonin from being taken back up too quickly, SSRIs help to increase the levels of serotonin available in the brain's synapses, which enhances communication between nerve cells and helps regulate mood and anxiety more effectively. Now, let's talk about the science. According to a study, at the end of an 8-week study, 73% of dogs treated with Reconcile chewable tablets show significant improvement as compared to behavior modification alone at 51%. During the course of therapy, 42% of dogs showed improvement within the first week, which was significantly greater than with behavior modification alone at 18%. The patient's response to therapy should be monitored. If no improvement is noted within 8 weeks, case management should be reevaluated. You can review the prescribing information for Reconcile by scanning this QR code.
And that's it for today's episode of Vet Candy Pop.
Thank you all so much for watching.
If you have a hot topic you want to share, connect with us at My Vet Candy.
Bye.
Bye.